and thank you all for making time in your agenda to tune in to this webinar, Transforming Care Pathways. Although the title is straightforward, I want to put your attention to the subtitle. We know as technology vendors, we like to talk about our technology, but this session will be really about how we can combine technologies from not only ourselves, but also from other vendors, vendors that are also promoted and sold by Connected Health, but even beyond that. My name is Dirk, and I'm the Director of Healthcare Partnerships in APAC, but also part of the Healthcare Strategy Core Team worldwide. As an agenda for you today, I have this 5 different points. I'm going to start with a little bit setting the stage, the realities, and how we can adapt to the new healthcare, let me say, requirements. Then I'm going to talk a bit about the innovations in how we can solve the new of the requirements that we put forward in the realities. The bulk of the time will be spent on the use cases. And for that, you're going to see later on, I'm going to even raise a poll to know exactly on which use cases I need to, let me say, spend more time. And also we're going to opening a little bit the, let me say, the window to look into what is next and where are we working on behind the scene before we open the Q&A. So let's dive into the new realities. Now, first of all, why do I put new between brackets? The realities are there. I think everybody see them coming since a long period of time. It's only a matter of, let me say, time before they're going to be there. But they are a little bit new because a lot of things has been accelerated due to COVID-19. Now let's start from left to right. Yes, we have the staff shortages. That was really coming in still a little bit before, but COVID has definitely not, let me say, improved that situation. Because of shortage and because of aging population and the things we're going to talk about later on, there is of course more workplace stress. That's a given, and of course having Australia in such a geographical big area is definitely not helping either. So that's definitely one area we need to spend some time on. We have the aging population, nothing new either, but we see here in 2025, that's next year, so very close by. We see of course that the percentage of population below 20 is not great. The majority is sitting between 20-25 and around 40-45. What is good, that is the working, let me say, part of the population. But of course, these people are getting older as well. Now, what you see in red, it's something that you don't always see, but it's a copy what I did from what we have here in Singapore. So the red line is in fact representing the amount of time, of how many times persons are on average put into a hospital bed. Of course, when you are young, you are born in a hospital, that's pretty straightforward. And then everything goes pretty smooth until you get a little bit older, and then you go from once, twice, average even 3 times a year spending time in a hospital. So you can imagine if that population who is now between 20 and 50, if they get older, what kind of effect that's going to have in the amount of hospital beds you will need. And if you have then a shrinking population, what you see on the bottom, that is definitely not helping. Next to that, of course, you have the expectations. I think we all expect to live much longer. We all expect to have splendid healthcare services, of course, if possible, for free. But we all know that it is mission impossible. So we need to find the balance between what the patient wants, what the government is able, willing to provide, and of course, what are the capabilities and the possibilities of the care providers. Now, putting this together is already a lot to chew on. It's already a lot of, let me say, challenges by themselves. Now, how can we adapt to that? What can we do to help out? Now again, from left to right, and they are a little bit in sync with the previous slide, for the staff efficiencies. There was a report last year from a McKinsey company who was, and there's a report from the US, by the way, but I think it still makes a lot of sense, is that there are, in fact, technologies out there who can save around 30% on efficiency for the nursing teams. And that's one of the areas where I'm going to focus on in the next couple of slides. There is also that, let me say, that move into the hospital in the home. Again, nothing really new for Australian setting. Even when I was a kid, you have the flying doctors programs on television. And by the way, I'm a Belgian guy, so even there we could see the reality of what's going on in Australia. But there is definitely a movement ongoing right now in how can we indeed expand the hospital beyond the four walls of the hospital. Knowing that each hospital bed cost, and just putting a bed in a hospital with the walls, with everything around that, cost around $3 to $3.5 million just for one single bed. So you can imagine, and on top of that, it takes you maybe 3 to 5 years to build. So that's a dilemma, and that brings, of course, the hospital in the home as a very solid alternative. Next to that, and also COVID has, of course, let me say, enlarged that problem, or enlarged the movement, is the population health. How can we, as a government, monitor the, let me say, the population? How can we derive out of all the information that is out there, information that pandemics are using of growing, that there are particular issues that we can solve? Is there things we can do on wellness and these potential elements? So these are, in fact, let me say, new delivery models that are putting into place. Now, I spoke in the beginning that I'm going to raise a poll, and that's what I'm going to do here right now. Because what I want to have your feedback in the hospital in the home setting. So Francisca, if you can open the poll, that would be great. Is it open? Because I cannot see it. So please. So if the poll is open because I cannot see it, please let me know, and I'm going to give you 10 seconds. If the hospital in the home, is that something that your organization is, first of all, doing? So yes. Not at all thinking about, no, or thinking about already. So if you can please answer that, that will be great. I give you 10 seconds. And Francesca, I will need you to read the response, because once again, I cannot see it on my screen.
Sounds good. I can do that.
Okay. So yes, let's close. I think we have time enough.
The result. Right, so the results shows 65% indicates yes, 5% no, and 30% says in the early stage of planning.
Okay, wonderful feedback. Yeah, thank you so much, Francisca. So thank you for that feedback, and I will use that to guide myself a little bit in time when we go through the specific use cases. So once again, thank you very much. So let's move further, and now we're going to look a little bit more in detail on the potential solutions. And one of them, I want to come back to the McKinsey company report that was done in May last year, so almost a year old now. But I think it's still pretty valid. And what you can see here on this bar is the typical average time a registered nurse is spending. So a little bit less than half of the time is direct patient care. Then there is 20-25% spent on filling in forms and working on the medical records and the hospital information systems. You have 5 to 7% linked to PD, and it is personal development. And then you have another 20-25% based on other elements, and the other elements are defined as searching, collecting elements, collecting whatever there need to be done, walking around, calls, these kind of things that happen in the back end. Now, at the end of the day, what we all want, and definitely what the nursing want, is having more direct patient care. The main reason why they are in fact a nurse is to take care of patients, not to fill in paperwork or doing anything else. Now, this study has in fact shown that they can optimize around 30% of their time by putting mobility into their pockets. So smartphones, smart tablets. And of course, the first thing you need to do there is how do you gonna power them? How do you gonna enable them? And that is one of the elements that Connected Health, together with partners and other partners of us, can in fact enable you to do so. So when you put a mobile device, we as Alcatel-Lucent Enterprise can easily provide you with security, secure Wi-Fi, connectivity, to make sure that there are no, let me say, issues from that point of view. Connected Health, of course, sells the SpectraLink phones. So there you have already directly a phone dedicated for the healthcare worker. SOTI is in mobile device management. So how do you manage the devices, software upgrades, you call it. And Improvata is then another vendor. But the vendor is important to make it easy for the user to use these smartphones. You don't want the smartphone to be open, qua login ID, passwords, and so on. But you don't want a doctor or a staff member or a nurse or whoever spending 1 minute each time she wants to key in something by keying in login IDs and passwords. So that's why we have these vendors behind to make sure that the technology is there to help you. At the other end, you need the application side. Yes, you need to have the medical record of the hospital information systems available through the smartphones so that they can work at the point of care, very important. And then the other side, and that was part of the 30% optimization, is in fact you need collaboration and delegation capabilities. How can you do that in a setting that makes it in fact usable and in fact more efficient for the staff members themselves? And that's where we as Alcatel-Lucent comes into the picture with our digital age workplace for cure and care program. Now, like the title said, this is one of the solutions. Okay, there are of course tons of solutions. I will not talk about them all, but come back in the use cases a bit. There is of course a lot of talk about AI. A lot of people think that AI is brand new. Sorry to say, but in fact the first AI in healthcare was used in the 1970s. So that's close to 50 years ago, and that was done in the biomedical arena. Of course, later on we had IBM Watson, and that came in fact around 2011 to 2015, where they're really very prominent in this arena, and mainly in the medical imaging. So AI by themselves is nothing new, but we do realize that with the 100 terabytes of clinical data that is on average collected per hospital per day, there is a huge amount of data that not a single person can analyze. And of course, AI is a perfect, let me say, technology to make that happen. Looking a little bit more closer to what we are doing, we are by origin a communication company. So that means that speech, a voice is important. And we are working in the backend from how can we use that speech voice to automate processes. But it is, like I said here, work in progress. That is something that takes time. You have the different languages, the different dialects, and it's not always so straightforward. Of course, with the large language models, This is getting more real, but it's still a while before you're going to see it popping up everywhere around. So this is in fact one of the solutions we were talking about earlier. Now, like I said, I was setting the stage with the previous couple of slides. Let's now deep dive a little bit into innovations before I touch base on the use cases. Now, this is one or two slides where I'm going to talk a little bit about what we are doing and why we are doing it and what makes us a little bit different than most of the competitors out of there. So when we talk about the digital age workplace for cure and care, we have in fact 5 different technologies that you can see. We have the connectivity, communication, that was the foundation from ages ago and still valid today, because you need to connect these smartphones, you need to connect in medical equipment. Communication is crucial. Without communication, not much you can do in a team setting, because hospital and healthcare is done by a team and not individuals. And then we have the 3 different, let me say, enablers. That's location. How can we use location to enable elements to automate processes? Notification. Make sure that the workflows are there, that things are taken care of in a due time. And of course, the collaboration. Now, what is happening and what happened in the last couple of years, in fact, is that in the past, until now even, and maybe even until the next couple of years, communication was the prime element. Having a phone somewhere, was it a mobility phone or a fixed phone, to call the different departments, was in fact the prime source or the prime way to have that collaboration going. Then there was the add-on of notification, all the alerts, alarms, do this, do that, something happening here and there. These are in fact elements that we all know very well. Now, if you look, and specifically if you look at to the hospital in the home, but also in the newer setting, and even during COVID, where physical handover was not possible, we see that there is a shift in technology coming. And you can see that here from 2, where collaboration is starting to get the main stage. Collaboration becomes the primary interface, enabled, or in fact, where notification is injected into, but also creating more context based on the location. And that's where the automation and all this kind of stuff comes into the picture. So this is in fact a technology shift. Sometimes you see it, sometimes you don't see it, but this is a technology shift that is technically ongoing as we speak for the moment. Of course, everything is there to, of course, improve efficiency and the health outcomes, of course. With that being said, how is the digital age workplace for cure and care helping you? And it is mainly within the hospital settings. So from the hospital setting themselves, of course, we provide the connectivity and the way the collaboration and everything is possible. But due to the left and the middle block, we help as well to make it as, let me say, easy and as enjoyable as possible for all the staff who is working there, and of course for the patients themselves. And that makes it, of course, easier for them or for the hospitals to attract and retain their staff, what is in fact a very important aspect. We have also CFOs who are calling into us and asking from, hey, we are losing between 3 to 5% of our medical equipment year over year. That's a huge amount of money. Is there a way to protect? Of course, you can put everything on a chain, but that is not helping anybody. But we do have technologies that can help you in protecting your assets. On the left-hand side, talking about the patient, you can see there the wristband. We know that the patient, after surgery, for example, they need to start to move around as quickly as possible to in fact improve their healing process. But with only having a button next to your bed calling the nurse call is, of course, not really promoting very easily. And that's why we are providing this kind of buttons to help in a mobility setting to move forward. And last but not least is in the middle is, of course, optimizing the work conditions, but more about that in a minute. Now, what is important from us? We are doing this because each hospital, each setting is different. So we do that in a consultative approach and in an open architecture. So that means we always going to build on top of what you already have. To give you an example, on the mobile devices that is in the hand of the staff, we can implement staff duress. We can implement immediately, like the patient wandering, asset protection, and that saves already 1 hour a day for the staff. And also all the collaboration aspects are integrated, and that saves 25% of the interruptions is coming from collaboration. So that's a very important element. Besides the classical ones, we can integrate the nurse call systems so that you have everything on your hand. You don't need to look around what's going on. Everything is personalized to you, for you. Even the patient thermal integration, limiting the frustrations at the same time. Facility related elements. People more in the north, in Queensland, where it's always hot and steamy and whatever. And the 7% is coming from Singapore setting, where 7% of the interruptions to the staff comes from patients. The sun is shining in my eyes, it's too hot, it's too cold, the fan is too hard, whatever it may be. But at 7% of the interruption. So the little things, what integration can in fact help already a lot. Now, by looking at that, do the innovation, how can we now make them practical? And that's why we're going to dive into the use cases. Now, the use cases, I'm going to tell you upfront, some of real world, implemented, tested, used, but there are also a few inspirationals. And that's really important because we are also part of trials and all this kind of stuff. And I definitely don't want to keep them away from you. Now, the use cases, and it is important to know, they are all coming from integrating other solutions. Okay, so it's not what just Alcatel is providing or even Connected Health is providing. And it's all about boosting the efficiencies. However, the names and the different things I'm going to talk about, robotics, robots, that's a technology, of course. Video AI is in technology, but that's a way in how you can differentiate the different use cases. So bear with me, there is a little bit technology in the back end, of course, but it's all for the efficiency and improved outcomes. The first one is a trial that was done here in Singapore, and I really love this trial. We know that people who need to stay for a longer period of time in the hospital, there can be a kind of loneliness. They are separated from the family. It's not always simple of family to be with them or to visit them constantly. And sometimes they need some mental support. Now, the trial, what they did here in Singapore, was in fact using a robot who went, of course, in predicted time, or in fact agreed time frames, went in fact to the different patients. And there was a video session enabled with people from working from remote. And from them, for the start, was in fact using volunteers, immobilized persons, but also retired nurses or nurses who were in fact not longer able to work due to the, let me say, body conditions, because it's a heavy work if you need to lift patients and so on and so on. And they were running that, and the feedback and in fact the outcome was really positive. There was also some learning out of it. As they started, the best feedback came from when they were using retired nurses or nurses who were not longer able to physically execute their job. So the HR departments can really tap into that because in a lot of cases, they are still motivated. They still want to talk and help patients, but they are not longer able to do that. And the retired nurses had the advantage that they could tap back if there was something discussed with the patient that needed the attention of the hospital staff. They were very easy to connect back into the hospital and to share that information. But again, that wasn't during the start, and later on, more volunteers and mobilized persons were able to tap into this kind of solution. At the other end, it's a robot, yet the robot goes by himself to the different patient and patient beds. Of course, you need to think about the environment, meaning, can the robot go into the room? If you need to open the door, yeah, okay, somebody need to open the door. The robot cannot yet open a physical door. Or when it's in an ICU, when there are full of cables or equipment around, it's also hard. So you need to think a little bit through that whole process, but it is definitely one way in how we can tap into a motivated remote workforce, but at the same time, increase in fact patient experience. And again, this is simple to set up. It's in fact pretty low tech. It's not that high tech. And it's one way to increase or let's say minimize the loneliness of the patients that's staying in the hospital beds. The second one is based on video AI. And video AI has in fact a lot of premises, a lot of possibilities. And this is in fact a live case, operational here in Singapore. It's a mental health institute for people with multiple disabilities. And in fact, the video AI, and in fact, they have 3 locations. Each location has around 150 cameras. So it's a pretty highly, let me say, secured and protected environment. But you can imagine each location, 150 cameras. Yes, you have the different video walls in the nurse stations, in the management locations, but who has time to look at it? Nobody. So yes, the cameras helped in the past, but with the reduction of staff and the limitation of staff, it was not really helping anymore. So they were looking for something additionally. Now, video AI is one way to, let me say, have a technology look into the pictures, look into the video streams, and figure out if there is an aggression ongoing, if there is a collapse, a fall, loitering, geofencing, people trying to escape. So all the kind of, let me say, incidents that happens in the facilities, is there a way to detect them automatically and then send the fact that notification to the staff instead of having people looking at the video panels? Now, by saying this, this can be done just by video AI, and we work here with Graymatics, that's the vendor of video AI. But there are also LiDAR or IR sensors. Kepler is using also video, Nobi is using LiDAR, and video, VIAR is more LiDAR. So there are tons of other partners we are working with who have in fact this kind of capabilities to recognize collapse, falls, and so on and so on. Now what we are doing is in fact automating that process. So when the camera or the video AI detects something, we send that information, the alert, to the close by medical staff who is available. We do that not only from, hey, there is something ongoing there. No, we are also providing additional information to help solving it. And what are the elements we are doing? Of course, if they can accept or decline, they need to do that in a particular time frame. If they don't do that, also fine, because maybe they are busy with something else. It's automatically then escalated to the next group, to the next people in the hierarchical setting. Besides that, you also have one camera button. And when they press on that camera button, they can live see what's going on that camera that detected that problem. There is also a link, and that link, the URL, is in fact opening a web page, opening the medical record. Now, in this stage, in this facility, we have the let me say, authorization and the consent from the parents and the people themselves who were able to do, to have also face recognition. Now, with this face recognition, we can, if the camera can capture it, of course, we have the capability when they press on this button to open the medical record directly of the patient in question. So they can see, okay, when it was a collapse, does that patient have their medication this morning? Was it taken? And history, and so on and so on, so that they have at least all the information in front of them, and they can immediately fill in the report as well. The other button is more a collaboration or a call button, and that depends on the case, where they can immediately call in their supervisor, call in the ambulance, call in whoever need to come to help out in the case. So this is a way in how video AI has in fact been helping them in becoming much more efficient, and in fact at the end of the day automating the processes. Another one who is implemented in multiple locations around the world and even in Australia, we have staff duress. Staff duress becomes pity enough. The caregiver is giving everything they can to take care of the patient, but at the same time, sometimes they are even attacked by the same patient. So pretty delicate situation, of course, something that nobody wants, but it's part of life almost. Something I don't like, but it is. Now here we have different ways in how to handle this, depending on the circumstances. On the top, you see the use of smartphones. You have specific smartphones like the SpectraLink. Now the SpectraLink has the small button on the top. Now when you press on that, you activate staff duress. That's one. It can also be the phone is not longer moving. You have also different type of phones who has this kind of button on the top. If you are an iOS lover and you use Apple, they don't have. But then you can connect a kind of a small button, a Bluetooth button, who is connected to the smartphone to do the similar thing. The second way is in the middle. There's using specific buttons, and I have here one in front of me that you can in fact put on your shirt or on a lanyard, of putting as a kind of a watch on your wrist, and when you press on it, you can in fact activate an alert. So this is another way of doing the same thing. The last one on the bottom is coming back to the previous slide, is using in fact video as an, let me say, a detector if there is indeed violence ongoing. And that's of course different options and flavors in how we can deal with staff duress. So definitely, depending on the technology you have, there are ways to implement. This one is a very specific one, and it is linked, and it is more an example on the contextual collaboration, and how can we use the location context to optimize and in fact create efficiencies. We are currently in talk with several hospitals in implementing something like that, because they had a request, they had a demand, but I just want to showcase what it is all about. So here we have two nurses, and please don't shoot at me if it's a nurse, male or female. For me, it doesn't really matter. These are females because that's the easier picture to get, to make really a distinction between a doctor and a nurse. So very sorry for that. For me, it doesn't matter. But what you can see here, so when they are in the ward that they are responsible for, they are automatically tagged as green. They are present, they are there, and they are automatically put in a collaboration group in the ward team that is there for their own operations, to do the delegations, and so on and so on. And they are also automatically put in the different alarm groups. So what's going on, what are the things that definitely urgently need to be executed, and so on and so on. Now what happened with one of the nurses are in fact leaving the ward, they are automatically taken out of this equation of the ward team and the notifications, because they are not longer present. Now also when they leave at the end of their shift, the same way. Now when then another nurse comes into the picture and start to work in the ward, that new nurse comes automatically part of that ward team, automatically part of the alarm group. So this is fully automated. Now, what is now the advantage? The advantage is when, for example, the other blue nurse would come back and she is then put back into the ward team group, she can in fact, or he of course, can directly see what happened during the other shift. So they have automatically a record. So that means as well that the handover, you can talk a lot during the handover, but the 50 minutes is only 50 minutes, but you can still go back into the chat information or whatever happened. You have at least that kind of information with you. And you have also the presence, so you know when the people are available or not to make phone calls, to reach out to that person. That also allows to have the user identity correct, because that creates then the compliance. So each person is recognized, each person knows where in, where out. So that's what you get with location dependent collaboration and alarms. A second example is around clinicians. As soon that you enter the hospital, they become as present, so they can be disturbed. If they go into in the operation theater, yeah, they go automatically. That's an area set as do not disturb. So automatically it becomes as do not disturb, and allow or in fact facilitate other team members who want to get in touch with this doctor, for example, knows in advance, okay, he's green, so I can call. He is red, I better do not disturb, or I send him just an IM and I wait until the doctor is back from whatever they are doing from the do not disturb environment. So these are in fact simple examples in how location can help you in setting the stage and in fact optimizing your operations. Because at the end of the day, it's a technology that needs to work for you. It's not you who need to work for the technology. Very important. Now coming to the hospital in the home. And this is a very important aspect. You have the medication reminders. If you are in the hospital, simple, you go to the patient, you tell, take the medication. Now here, based on the system, when the system detects, okay, you need to take your medication twice, 3 times, once a day, we can send in fact that information to the patients. And it's a pager-like alert. And it is mandatory to acknowledge or decline. Otherwise, it's going to keep on beeping. It will not leave you alone until you acknowledge or decline. So you have the registration as well. So that's a good way to make sure that, of course, the medication is taking place. If you are in the hospital, the nurses are doing their rounding. They go once, twice per day to the patient and have a small chit chat, but in fact, there's questions to figure out how they feel. Now, if you have a patient at home who is in fact able and a little bit tech savvy, there is no big deal to replace that with a kind of a questionnaire. And this questionnaire allow you to, in fact, to get the feedback even without using your own resources. It's done by the system, and the feedback is put back in that database. Of course, you can use the technology for teleconsultation, but more about that in the next slide. So this is in fact the first, let me say, way in how can you enhance the patient engagement in a hospital in the home setting. Now, what we hear very often is the opposite way, is in fact when the patient want to talk to their caregivers or the family want to talk to their caregivers. Maybe they have a specific application, but in a lot of cases they want a basic phone. And we see here even in the Singapore setting that it is like very difficult. And don't ask me why, because for us it's natural, it's so simple that the patient want to dial one number and be able to talk to their caregivers, who can be different people, different shifts. So we have the intelligent routing, who will in fact call or let ring the phone of the person who is in charge of that person at that point in time. So this is all automated, very simple for us, but it seems like not so simple for a lot of our competitors. In the same way, When then the clinician or the doctor want to reach out to the patient, and the patient is only reachable through a mobile phone number or a number, the doctor, of course, want to do that through their mobile phones. But nobody want to expose their mobile number. So we also have here the solutions to make sure that only the office number is displayed at the other side. So make it very normal for the patient. They dial one number, they receive on the same number calls, and it's all linked to their medical care. But even the doctors is, like I said, use their mobile number. For us, it doesn't matter. You see here the Epic. We have in fact a solution, and that is coming of integrated with the Epic Hyco. That is one of the rover applications or Epic. When you can, or where you can make a phone call through, for example, the parents or whatever number that is registered in the Epic database. Now again, if you press on it, the doctor will make a GSM mobile call, again exposing their mobile number. Now we developed a technology that will reroute this and in fact put an office number instead. So again, to make sure that nobody exposes their mobile number even while they work from their smartphones. And then of course, as you have all the collaboration tools, audio, video, a picture of your wound, a picture what's happening with whatever is going on with you. We can do even IoT integration, and you can all do that while you are removed. So this is definitely helping in staying close with your patient, even when the patient is far away. So these have been a set of use cases that, like I said, is inspiration and even a reality, but that can really be used in optimizing the efficiency and in fact improving the care wherever they are. I was promising as well to do in what's next. Now, one of the elements that we as Alcatel-Lucent Enterprise are working on, and this is in France, we are a French company, is in fact creating a solution together with other partners. The names are here. And a way in how do we get the medical information to the right people, and in fact the right information to the right people in time, may it be GPs, pharmacists, physiotherapists, other care providers, family members, it doesn't really matter. So how do we get information to all the different stakeholders who take care of you, by the way? Specifically in the French setting, the medical records are everywhere. And that's one of the, let me say, advantages of this solution. We know that in Australia, mainly per state, you define what is the medical record that is used and maybe will be used in an, let me say, population health setting. What is good, what is already a first part of the solution. But just for your information to know that we are working on something similar in case that you do not have a standardized medical record or a medical database in whatever sort. So this just to highlight the intent in where we as a company are working in. With that, but just correct one more thing. Change management. And I think that's a very important one. As you can see in this small little drawing there, a simple command moving forward, if you are sitting in a round boat, is not really helpful. So how do we change things? Now, I have been working for more than 20 years in the healthcare and trying to change and succeeding also doing change management. Now, my 5 cents, personal 5 cents, is it works well if it starts within, meaning ground up. If it's a top management decision, it can take a while. We have seen that with the first implementation of the medical records. I can tell you, if you need to spend 10 times more time on the computer to feed the computer than time that you can have for your patient, it will not work. So it needs to start from within the organization. It needs to start from the ground up. You need to have the early supporters. Of course, from the ground up, it's easy. But you need to have as well the CXO buy-in, the support. That's fundamental. And it's not always straightforward. You're going to have the ups and the downs. The up is in the beginning, that's fine. Then a little bit some technology hiccups maybe. A little bit people starting to realize it's not 100%, but only 90%. And that's why you need to have sometimes a pull through and really communicate. When you do that, your chances of implementing new elements in a hospital setting is improving drastically. Now, what are we doing? What are we trying to do to help you? And what we are more than willing to do as well, because that's a service that we are offering, is that you as stakeholders, when you sit around the table, you are not always aware of what technology can bring to you. Again, we try to bring technology that works for you. We don't want you to work for technology. Very, very important. Now, what we are trying to do, or what we are proposing, we can set up a work session where we discuss or first hear or listen what are your, let me say, elements you want to change, your pain points, things that is not working well. We can discuss potential technology options, talk about use cases, references, linking you up with the references, and having in fact a kind of a worldwide perspective. Then later on, and it is very important as well, is having an early stage proof of concept or demonstration, where you get as soon as possible in that cycle the stakeholder feedback. And then you can make very quickly or adapting, fine-tuning, or even when it's not really in the likes or not really what is required, or you don't really feel it, just stop it as soon as possible. That's also an option. But it is important to have this thing started as soon as possible. So that will definitely enhance the change management. Now, as a quick recap, and before I give the word back to Francisca for Q&A, we spoke about the realities. We know healthcare is very dynamic. We spoke about the innovations, about what we are doing together with Connected Health in that change into the contextual collaboration. The use cases, I hope they were useful. And of course, there are multiple others. So please feel free to reach out, challenge us, and we're going to work together with you to make it happen. So with that, Francesca, can you please help out on the questions? If there are, I hope.
Sure, Dirk. Thank you for the insight and presentation, and that's giving us some insights around the use cases and examples of AI working well in the healthcare environment. Very useful. And so a couple of questions, mindful of the timing. While Australia has made investments in digital health infrastructure, including electronic medical records, telehealth services, there may still be gaps in the connectivity and network infrastructure, especially in the regional and remote areas. So what kind of solutions can you give us regarding this challenge?
That's thank you, Francisca, and thank you for raising that question, whoever it was. This is, of course, in an Australian setting, a very valid question. Now, in the very remote areas, it's hard. We know that. But the communication and collaboration, communication, connectivity, that's really the fundamental building block for everything that runs on top of it. Without that, it's almost a no-go. So the minimum is a telephone call that you at least can call. The next is a little bit data. Now, what can we provide? We can help you in with some partner of us to get connectivity, but these are very expensive, so not always the best. What I have seen in other remote areas, like we do in the Philippines and in other areas, because we are also as a company working on hospitality, we have seen that the take-up of companies like Starlink, so satellite communication, the Elon Musk type of Starlink, is in fact a, between brackets, cheap way of having at least that collaboration connectivity capabilities. So I would suggest that at least look at this type of solutions next to then the classical service provider connectivity, like the good old Telstra, you call them. These are in fact the things that you can look at. And for me, and what I have seen that works very well, is the equivalence of the Starlinks. I hope that's something that could get or be available in the remote areas for you. I hope that helps as an answer, Francesca.
Thank you. Now, we talked about the solution when you mentioned about interoperability and how that integrates with Epic. Overall, as technology vendors such as ALE, how can digital solutions and how can the vendor actually ensure that everything interoperable with existing systems, within the hospital and healthcare setting? Because that is quite important, and it seems quite a important topic to touch on. And considering that Australia is on the journey and start embracing digital transformation.
Yeah, that's in fact a very, very, very valid question again. And it is simple at one end, but also complex at another end. It is absolutely fundamental that whatever solution you select is that you really select a solution who has that openness in mind. If you do not have a solution with openness in mind, you're going to be locked in. And it is the last thing you need as a healthcare provider, because healthcare is a team sport. It's not something individual. You need a team around you with different specialties. So openness is the number one thing you need to have. So I would put that as a number one selection criteria of everything that you put in your hospital. At the other end, once you have that openness, everybody uses particular ways, standards to communicate, to collaborate. And that's where we as Alcatel-Lucent Enterprise and Connected Health can use to help you in integrating then all the different, let me say, elements you have. In the medical records, you have the HL7, you have the FHIR. These are standards that are very well known. If you support already these, you have already an openness. All other products that you have, more and more we see the movement to MQTT, to REST APIs, from old standards. So that's all moving into that, let me say, way to communicate and integrate. If you have these technologies, every challenge, any challenge can be resolved. So search for openness, make sure you select products that are open, and of course work with vendors who has that in mind, like ourselves, where openness is number one, is the key thing for us to help you. I hope that answers, Francesca.
Thank you, Dirk. I think we're just about running out of time now, so I think I'll pass it back on to you to wrap up, and we can finish up.
Okay, thank you very much, Francisca, and thank you all for the questions. First of all, like Francesca said in the beginning, this webinar has been recorded and will be made available, so feel free to download and eventually share with other people. As a conclusion, you have here also my name and my contact details, so feel free. But of course, you can also reach out straight to Connected Health, who are there to help you out with any possible question. At the other end, as a closure, we are February the 14th. We know we love to take care of people. That's part of the business we are all in. But don't forget your loved ones. because it's Happy Valentine's Day. So please don't forget to buy a bouquet of flowers or invite your partner. Otherwise, maybe you're going to have some other problems if you come home, and that's definitely not something we would like to have. So with that, I would like to thank you again for being part of this, and really feel free to reach out at any point of time. We will keep this slide on, by the way, for a next minute, so that you can write down the contact details if you want. So thanks again. Have a great day, and see you later in maybe one of the next webinars. Bye.
Thank you, Dirk.